everybody. Thank you for tuning in. I am excited to share a little bit about my nurse practitioner journey with you and also answer some questions that you may have if you're considering becoming a nurse practitioner or if you're just wondering about this career and what I do. Got my notebook right here. I'm going to be reading from my notes, so excuse me for looking down from time to time. So what is a nurse practitioner? Plain and simple, a nurse practitioner is an advanced degree nurse. Basically, it's a nurse with either a master's degree or a doctorate degree. What do nurse practitioners do? According to the American Association of Nurse Practitioners, NPs are trained, licensed, and independent healthcare clinicians who concentrate on managing patient health conditions by treating injuries and illnesses, as well as doing preventive care. So, in short, nurse practitioners are a lot like doctors. We can prescribe medications and diagnose conditions like doctors, but our scope of practice, which means what we can and what we can't do, is determined by the state that we live in. In states like Michigan and Florida, nurse practitioners are pretty limited in what they can do and what their scope of practice is. In other states like Washington and Colorado, nurse practitioners can practice independently. In some states, nurse practitioners can even open their own clinic and have their own business. So why do we need nurse practitioners when we have doctors? The NP career is actually not very old, but it did start in the 1960s when there was a shortage in pediatric physicians. At that time, nurse practitioners has to step in and help the doctors because of the wide shortage and health crisis. Since then, the role basically expanded and now is basically intrinsic in the healthcare system. Initially, NPs were widely utilized in rural areas because there was just not enough primary care physicians, but now they're basically everywhere. So are there different kinds of nurse practitioners? There are many different types of nurse practitioners. There are family nurse practitioners, which is what I'm in. There's acute gerontological nurse practitioners, which mostly handle the acute care side of things. There is women's health nurse practitioner. There is pediatric nurse practitioners. There is nurse anesthetist. There is nurse midwife, and there's also psych nurse practitioners. So how does one become a nurse practitioner? To become a nurse practitioner, it's no surprise that you first have to become a registered nurse. It takes about 2 to 4 years to become a registered nurse, depending on if you have an undergraduate degree or not, and then it takes another 2.5 years to become a nurse practitioner. Where do nurse practitioners work? So nurse practitioners can work basically in all kinds of environments. Some nurse practitioners work from home, some work in clinics, and there's also a nurse practitioner who works in the hospital setting. It all depends. Do nurse practitioners make good money? This is my personal opinion because obviously I'm a nurse practitioner student and I haven't started making an income off of this profession, but it depends on the state that you live in. I'm just pulling up Google. It honestly depends on what type of nurse practitioner you are, correlate with what your income is. The highest paid nurse practitioner is a certified registered nurse anesthetist, which is basically an anesthesiology. These folks can make up to $180,000 a year. Psych mental health nurse practitioner make $140,000 a year, which is pretty good. Pediatric nurse practitioners makes $130,000 a year. So ultimately, it depends on where you work and what clinic, what kind of setting, but your salary is correlated to what type of specialty you're in, what kind of practitioner you are, how many experience you have. Is it hard to be a nurse practitioner? Not going to lie, I think there's going to be some days that's going to be challenging. There's going to be some days that's going to be great. As a nurse practitioner, I will be doing things from screening all the way to prescribing medication. Screening, which means doing a head-to-toe assessment, might just be chatting with the patient and getting a history. But on the other hand, when you are prescribing medications and this person is now working side by side with you to get the best medical care, it can be kind of challenging because you are now responsible for another person's well-being. But at the same time, if you are able to help them beat this disease or beat this condition that they're trying to beat, it really is a team collaboration and there's nothing like it. To tell you guys a little bit about myself, I am currently a a registered nurse. I've been working for about 5 years. And last year, during the middle of pandemic, I decided that it's time to go back to school. So I started thinking about what type of career path I want to take. Being a nurse is very fulfilling, but oftentimes I think about what else I can do to take my skills to the next level. I am currently in my second year as a nurse practitioner student. I am currently taking health assessment, women's health, and pediatrics. I have about a year and a half left in my schooling, and it's been a full journey the whole way, a very fulfilling, very rewarding journey. Thank you so much for watching this video. If you enjoyed this kind of content, please like this video and subscribe, and I will make more videos about this. I'm excited to share all my journey with you guys and hope you have a good day. Bye!